Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. We got a really thought-provoking show that Sarah can't wait to dive into. We're going to be talking about body dysmorphic disorder, the long-term effects of gender transition surgery in adults, and lastly, a plastic surgeon on trial for the death of a teen. It's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for joining us. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me always is Sarah.
Hi.
What's up, Sarah?
What's
In
up?
the box is the great Travis. What's up, man? How you doing?
I'm good. How about you?
Everybody? Yeah, good. Yeah, good week. It's Friday. You gotta love Friday. I was just telling Sarah how much I love doing the show because it means it's Friday and the week's kind of coming to a close. So it's hard. I don't know if I could do the show on Monday. I mean, I feel like I would be like less excited.
Yeah.
You know, do they do
too.
shows on Monday, Travis, or do you just kind of start on Tuesday around here?
No. They definitely do shows on Monday too.
I have to.
definitely do
Man,
shows.
that's impressive. I don't know. Like, I feel like if you're doing a show,
Are
you
they
got to be
sad
upbeat.
shows?
Sad shows, like depressing stuff. I feel like
Are
if
they
you-
murder mystery shows?
Oh, that's good. It's like Monday you're feeling kind of down, talk about dark stuff. I don't know. I feel like I have to be upbeat, and so I don't know if I could be this upbeat on a Monday.
Yeah, I don't think I would be.
So you gotta be a Monday warrior.
Yeah,
what
I
it
guess. I'm gonna have to tune into some of
Monday
these Monday
warrior.
shows and see how they go. We should
Yeah.
do a little experiment and see which ones are happy.
They're not very good. It's all right. No, I'm joking. I'm 100% joking.
I know.
100% joking.
Right on. Well, it's been a busy week for me. I know you guys. I told you guys I was buying a building, which is like I knew that is like a big deal because buying a house is a big deal, and this is even bigger. But I didn't realize how big of a deal it was. We finally signed all the papers this week. So
I like how you casually say it too. Oh yeah, I told you I was buying a building, right? Okay, yeah.
Well, it's not like a skyscraper or anything. Like it's like an office building. So it'd be cool if it was like a
Yeah, so
skyscraper.
you're not like leasing a building anymore.
So I am leasing to myself
Okay.
and my partner, and then one other doctor. So
Okay.
so I'm in kind of like a landlord. I don't want to say like tycoon or mogul, but I'm just kidding. No, it's just an office building. It's like a medical office building. But it's like it's just so much. It's so much to like do, and I mean it's been like a months long process. And the crazy thing is that it is good to get this behind us because it was just a huge hurdle to get like all the bank stuff like set up and all that. But now what I'm going to do is when I actually move into that building, which I have to renovate it. So there's that. I got
Oh, that sucks.
Yeah, I mean, luckily the suite that I'm going into is actually pretty nice. And so I'm really just doing like aesthetic stuff. Like I'm not tearing down walls or anything. We want to make like something really posh, like a South Lake, Highland Park type, med
Yeah.
spa.
Yeah,
Well,
yeah.
I don't have a med spa right now, so I'm having to start like this whole new business. And so it's like, okay, there's starting the business of owning the building, starting the business of the med spa.
Mm-hmm.
So it's like, I mean, I'm still doing my surgery stuff, but I have all these other plates I'm spinning.
What's like the main thing that med spas do?
So med spas will have a variety of things. Botox fillers are going to be, a anchor of all of med spas. But then other types of procedures like lasers, intense pulse light, microneedling, things like that.
Okay.
Hydrofacials. And so like in the past few months, we've been hiring, not really hiring, but signing contractors like nurse injectors. And getting them trained on all our equipment so that when we do open, things will be kind of up and running. So
That's cool.
yeah, it's exciting. It's just a lot of work. And Morgan is the girl that's going to be managing my med spa. She's been great. She's really been an anchor, honestly, kind of keeping me on track.
Yeah, I was about to ask if you were gonna have like a expert meds, like somebody who's like worked in a med spa
So
before.
I know a little bit about it because we've been doing these things that a med spa would do in my own
Yeah.
office for a while. And over the past couple of years, just me and Morgan, who's actually my nurse right now, have been talking about opening something. And I have to give a lot of credit to her. She's been doing a lot of research on it, and she goes and talks with med spas that are open now, and learn what works, what doesn't. So I think we have a pretty good game plan going into this. But
Cool.
But it's just a big endeavor. But that's how things are, right? I mean, anything worth doing is hard or takes a lot of
Always
work.
takes a little bit of a risk
So
too.
yeah, right. I mean, as a business owner, I mean, starting a business is a risk, and
It's risky.
it's a lot of hard work and takes years before it pays off. But I mean, that's what we do, right? I mean, you got to try it.
Now, if
Yeah.
you need some extra help, Dr. Herman, I
Yeah.
will lend my services as an extra nurse. So just
Okay.
let me know. I got the
A
outfit.
nurse of what?
Whatever you need, like whatever they need, just let me know, and I got you.
Okay, man. Dude, I always have people ask, like, when I tell people I'm a plastic surgeon, like, oh, do you need someone in your office to help you, like, take pictures of befores and
Oh,
afters?
God. I didn't even think about that.
I'm like, well, I don't know, maybe, but probably not.
I didn't even think about that. That's funny.
All right, man, Joe. Well, listen, man, when this show gets huge and we're on national spotlight, I mean, I need you then. So I'm going to be hitting you up.
I got you.
It's just a matter of time. We're on the precipice.
Yes, indeed.
Yeah, the three of us. We have to hit, what was it? We're going to hit Paris Fashion Week next year because we're so big.
Yep.
I think we're on track. I mean,
Oh.
You can ask like the really pretty models if they've had any plastic surgery.
I'm sure they would love that. I was thinking more you could ask them about fashion,
I know, I'm just being nosy.
But we could ask them. I mean, I would be like, you've obviously never had plastic. I know how to talk to people. You've obviously never had plastic surgery. Can you tell people how you look this beautiful without plastic surgery or procedures?
Ooh, I like it smooth.
Yeah, I know. I know how to work it, man. All right. Well, good stuff. So I'll keep you guys apprised on that, and I mean, it's going to be a year-long process. But
Absolutely.
it'll be fun. So, okay. So moving on. Speaking of beautiful people, did you guys see in the news this past week about Megan Fox?
I did
About
not.
her talking about body dysmorphia?
Yes, which
Yeah.
blew my mind because I would say
She's
that.
had a lot of stuff done though to herself.
Yeah, I mean, that's a whole nother dive that we could take. I didn't really dig into like what she has done to herself. She does look different now than she did when she was younger. I mean, of course,
Yeah.
we all look different, but she looks almost as if she may have had something done. But I didn't really dive into that. But it was very shocking to me, honestly, to hear her say that she
Yeah.
suffers from body dysmorphic disorder, because I've always thought that she's just one of the most beautiful women, in Hollywood. And but that's just how body dysmorphic disorder is, and I did want to talk about it. And it's kind of funny because both my wife and my nurse at my office say that I have body dysmorphic disorder because I get really stressed if I gain weight, and so. And we'll talk about more about what it is. I don't really think that I could be clinically diagnosed with it, but it's something that I get, and I think to a certain degree we all get the idea.
No, I definitely deal with it all the time.
Yeah.
I see flaws that nobody else sees.
Right, and
Constantly.
that's it. Yeah. So anyway, so Megan Fox came out. She was working with Sports Illustrated. She's the swimsuit model cover for this year, which is fantastic. 37 years old, actress. I don't think she's done any modeling. My wife and I were discussing that last night. But she's mostly an actress and been on a lot of covers of magazines. And she said, and I quote, "I don't ever see myself the way that other people see me. There's never been a point in my life where I've loved my body." And it's just so sad to hear that, and shocking for someone like Megan Fox to say that. She wanted to talk about how it even started when she was young, how she would obsess about certain things about her body. And
Well, she was sexualized really early on in her career anyways.
was she? I thought
She
that
developed really quickly.
did she? I read that she began so she did begin modeling as a teen. I knew that she wasn't like an adult model, but I think modeling as a teen.
Yeah, I just remember seeing her on a Lindsay Lohan movie, a very long time ago. I think it was I think it was a Disney movie or something.
Oh, she was on Disney before. I can't. The first thing I remember seeing her in was a Transformers movie.
She
was in there before
she
that.
was in movies before that.
Was she?
With Lindsay Lohan and stuff.
She actually had a very interesting kind of backstory. She grew up in a very strict religious kind of family. And so I was reading that she basically saved up money so she could, I guess, move out of that or
Yeah.
move to
Did
LA.
you ever see that movie that she was in called something I think it was Jennifer's Body?
I haven't seen it, but I remember reading that she said that was her favorite movie. Have you seen it?
Yeah, it's weird. It's when her body gets taken over by a demon.
Get out of here. It's
She,
like a horror fluid?
Yeah.
Is it
And
good?
She turns into this freak.
I
Just
haven't
kills.
seen
She She like seduces men and like kills them, or like,
Really?
and women too.
She like eats them.
Yeah.
She eats. She's a cannibal.
Yeah,
Oh my god.
She eats them.
Okay, I'm gonna have to check this
Yeah.
out.
That's like
Megan Fox
that's
is a
when
cannibal demon.
you'll
Okay,
look
I'm
at
in
her,
on that.
You'll look at her completely different after you watch it.
Okay,
like,
I'm gonna watch it.
She's like like the way you see her. To me, she's always looked very like intimidating and like
She does
really,
she looks intimidating. I would agree with
like
that.
she
has
doesn't.
that look
She
about
doesn't
her.
look like she just seems like she could be a big old B word. And then I don't know. Like she kind of just like
Okay, I
seems
get it. Like she
scary.
looks like very assertive, and yeah, I mean I get that.
Like
right?
you can't get past her.
Yeah.
Like, nothing.
Anyway,
She
well,
doesn't seem happy-go-lucky. She seems,
maybe she's got these inner demons that we
Boss.
just didn't know about.
yeah.
Right?
That's probably why she liked it so much, that movie. 'cause
She probably did, yeah.
Probably.
I'm going to check that movie out. I'm going to give you a
Yeah.
full report. Anyway, so she was talking about when she was young that she had these issues with her body, and it was just really sad to hear her say that. And shocking just because of how most people perceive her. But that is kind of the hallmark of body dysmorphic disorder. People see discrepancies in themselves that other people don't see, and it's characterized by an excessive preoccupation with like an imagined flaw, right? So if somebody has a defect, like say they were in a car crash and they have some bad scars, or maybe they put on 80 pounds and they're unhappy with that, then that wouldn't really qualify for body dysmorphic disorder. In order for it to be a true diagnosed body dysmorphic disorder, it has to be something that's considered either unnoticeable or not a negative by the average person.
The way I think about it is like when you look in the mirror, you see like almost like a disfigured, like a clown mirror, but everybody else sees you through a regular mirror. But when you look at yourself in a mirror, you see all these things that
bad
are
things, right? Things that
Yeah.
stand out, yeah. So you would say like you see like maybe the way your lips are and be like, this looks horrible, and then the average person would be like, you look
I
fine.
wish I had your lips.
Right, yeah.
Yeah.
What are you talking about? So it does affect a lot of Americans. Between 5 and 10 million people in the United States have the, I guess, clinical diagnosis of that, because there is a requirement, and that's why when I was talking about myself, I don't feel like I probably meet that requirement. It does require a preoccupation, the preoccupation of your self-image to cause significant distress in your life to the point that it starts to disrupt your work life or social life. And so that's why I think that it's not a diagnosis that 100 million people have, right? Because I know when people talk about it, I understand it, not just because I'm a plastic surgeon, because I see that in myself. And so it's just something that it can totally consume people.
Yeah,
And
I feel like if like you have, like you were saying, like you get up really upset if you gain weight, you're not the type of person that's like, I'm not gonna go take my wife out on a date to a nice restaurant because I don't want to gain weight.
My craziness
Like you don't do that, but
well,
like somebody would.
What I would do though is if I'll like get to a point where I was like, okay, I just
gotta
can't
watch
do
what
this
I
anymore.
eat right
I'm not going to eat. Like I'm just not eating.
Yeah.
And I don't know if that really disrupts my life, but that's when my wife.
It's not the healthiest.
Well, I know, right? Dr. Heal thyself.
Yeah.
That's when my wife's like, okay, you have problems. Like I know I have problems. I accept that I have problems, but. But yeah, I really don't feel like I kind of meet that formal criteria, which usually that is made by a clinical psychologist or a psychiatrist.
Yeah.
And fortunately, there are treatments for this, and it can be treated to the point that you can kind of get your life back on track if it is something that consumes you and starts to affect your daily life or your work life or social life. The most effective therapy would be cognitive behavior therapy. And so that's where you talk with a counselor, a psychologist, even a psychiatrist, and you start to replace the bad kind of things that come into your brain and replace them with good.
Yeah.
And so it's a lot of exercises, things like, okay, well, what are you thinking whenever you start to obsess about this? And then and I'm not a therapist obviously, but they'll try to replace that with something, that the negative with something that's positive. And there's a lot of research to show that it's very effective, and cognitive behavior therapy is actually effective for many mental
yeah.
kind of issues that people have. The other thing that you can do are take drugs. Some of the SSRIs like Prozac and all those various drugs, Zoloft, have been shown to be effective in treating it because it is a type of OCD. It's separate from obsessive compulsive disorder, but it falls under...
Because you're obsessing about something.
Right, you're obsessing about something. So it falls under that DSM-5 category of obsessive disorders, even though it's separate from OCD. Group or family therapy has been shown to be helpful. This is where you can get support, which, anytime you have support trying to get over something, you're going to do better. You can also learn different coping mechanisms, way to when you have these feelings, to kind of put them aside and kind of get on with your life. And lastly, techniques for stress management have been shown to be actually helpful for this. So things like taking up yoga, meditation, or even exercise. So, body dysmorphic disorder is something that, as a plastic surgeon, that I'm well aware of in a more professional sense, not my own personal sense, because I really feel like it is a duty of plastic surgeons to not treat people who have true body dysmorphic disorder. Because, unfortunately, it's rare. You're talking about 2 or 3% of the United States, so it's a pretty low number. But I have personally seen people come in that have it. And, the classic patient that will come in that I feel has body dysmorphic disorder is, just as we've all been talking about, they'll come in and say, I want to have surgery on this certain part of my body. And I look at them and I'm like, you look fantastic. Like, anyone would want to have what you have. And one of the more common things I see is people wanting liposuction, and I'll look at them and they're like super fit, and I'm just like, there's nothing I can do for you. And it's important that plastic surgeons have that will to tell a patient, no, you don't need surgery.
Yeah.
Because there's a lot of research that shows that if those patients that truly do have body dysmorphic disorder, like a diagnosable disorder, that if they have plastic surgery, overall their long-term satisfaction is low. Because they'll find something about the surgery they didn't like, or they won't think it's good enough, or they'll just fixate on something else. And so, whereas the research shows that the average person that has plastic surgery is very satisfied with it long term, with a few exceptions, a person with body dysmorphic disorder will not.
Yeah.
And so, for plastic surgeons, I think we have a charge to do the right thing and help people. And when I have people come in that I truly think have body dysmorphic disorder, I usually say, look, you should talk to your primary care doctor about this, who potentially could refer you on to a psychologist or psychiatrist.
Yeah. I'm sure social media doesn't help with any of this.
Of course not. No,
comparing
absolutely
stuff.
not. And we've talked about that a million times, how social media is really making people kind of crazy because it's giving these unrealistic expectations
I
of what
follow a
normal
lot of
is.
women on social media that are like fitness girls too.
Yeah.
They're like, look, I can pose in certain ways that make me look better, just like anybody can.
Oh, yeah.
But and I can also, whenever I'm, sitting down, crouched over, putting weights on my bar, does my stomach grow? Yeah, just like everybody else.
Yeah, just like everybody in existence.
Yeah,
Right.
and I think it's so crazy that people are just so, there's women out there that just don't understand that, and they just don't.
Yeah.
They're just not. They think that nobody has that.
Right.
part.
I've heard people say that before, like coming into my office, say, well, when I go like this, I feel like I'm overweight. I'm like,
when you go like that.
Well, yeah, when you bend over.
Bend over.
When you bend over and have a little roll, I'm like, no, that's normal. Hey, you should have. If you didn't have that, I'd be worried about you.
Yeah, you would be like, are you eating enough?
Yeah, right. So, but anyway, it's an important topic, and it's something that, well, for me as a plastic surgeon, I'm always thinking about that when I see patients. But for the average person, you may have someone in your family suffering from this and not realize it because they're kind of keeping it in. So it's important to kind of recognize those things.
I'm guessing that women have higher percentage of having body dysmorphia. It's men?
It's actually equal.
Oh,
equal
nice.
between men and women.
Because I feel like women usually have more cellulite, and that really messes with girls' minds. Even as fit as I am, I still have it.
Of course.
And so it's like,
you're normal.
Yeah, I know.
Well,
I know it's normal.
You're above normal. You're extra fit.
Well, thank you. But I'm saying it's just normal. But when you look at social media or you look at other celebrities, they don't have it. But that's because they don't have it because they go get these, extra treatments, or they just don't
airbrush their
show it.
photos. Right, yeah,
They
exactly.
just don't show it, or they pose in ways that you're never going to see it because they know the tricks.
Yep. Well, yeah, it's all for celebrities and influencers. It's all about branding and I don't know. I always feel like when people are more real, that I personally am more interested in what they have to say. When people come across as just fake, I'm just like, I don't know. But we all do it. I mean, we all do it. I mean, I'm different on here than I am in real life. I mean, a little bit. I'm kind of the same, but I'm not usually this kind of, as you know. Do you think I am?
No, you're pretty outgoing still in real
I
life.
am pretty outgoing, that's true. Yeah.
I'm pretty chill all the way through everything.
All right, Body Dysmorphic Store. Leave us a comment. Let us know what you think. We'd love to hear from you on that topic. So, okay, moving on. This is a topic that I came up with based on an interaction I had on social media in the past week, which really shocked me, honestly. Of course, I hate whenever I get to the point where I think, oh, social media is like a good place, and then you realize that it's not. There's just a lot of negativity out there. And it came about because there was somebody on social media talking about, which is in the news literally every day, is the gender transition surgeries in kids. And so, I'm pretty passionate about that. We did a segment about that I don't think that that's a good idea because of all the various reasons that we talked about on that episode. And so I made a post, said, hey, I'm a plastic surgeon. I actually will do gender transition surgeries in adults, under the right circumstances. I don't do a lot. I do maybe one every year or year and a half. So I'm not out there doing these surgeries all the time. But I don't think that it should be done in children because of the various reasons that I stated. And so it kind of blew up, and I caught like a ton of flack. But I didn't get flack because I said that children shouldn't do it, which, I thought somebody might say, oh, well, they should, and I mean, that's their opinion. I caught flack because I said that I'm okay with adults doing it. Like, it was crazy. My mentions were like blowing up with people that said that, oh, why are you doing this? And this is bad, and people shouldn't do it. And like, it really kind of depressed me, honestly. I don't know. The way I feel about it with people that want to do gender transition is that, everyone in the world, and especially us as Americans, I mean, what do we want? Like, we want to be free, right? Free to live our life how we want to live.
Yeah,
and
free to be happy.
Free to love who we want to love, free to express ourselves how do we want to express, and do it without, being fear of being persecuted.
Yeah, you might have gotten extra flack because it's Pride Month.
But I was getting flack from the opposite direction.
Oh.
Yeah,
I
that's
know,
what I was
but
saying.
from like people that were like just extra
But
hypersensitive.
anyway,
to
I mean,
it
as far as
because
that
it's
goes and like freedom, I mean, that should carry on to our bodies. Like our bodies are our biggest form of self-identity. And so, it's an inherent right that people, if they're not harming someone else, should be able to do what they want with their own bodies. And people do it already. It's been done for decades. I mean, there's body modifications. There's things like plastic surgery. There's changing your hairstyle. Yeah, I mean, there's so many things. And I feel like that has to apply to people that want to have gender transition surgery as well. I mean, going through that process for people is not some snap decision. I mean, it's a decision that they make over years with lots of soul searching and going to medical appointments and, having to deal with, all the stigma that goes along with it. I mean, gender dysphoria is a real thing. We know that. It's accepted worldwide. And so, when people want to go through that, they should be respected or at least left alone and not attacked. And once again, I think the American populace, like of all people, should respect people's right to personal freedom. If someone's not harming someone else, then there's no reason that they shouldn't be able to do what they want to do. And that goes for even if it's something that's not something along societal norms, or maybe it's something that's not even within your own comfort zone, or maybe you don't even agree with it. And I think that's the way it should be, because if we say to one person that you can't do with your body what you want to do, you're a consenting adult, you can't do what your body want to do, then what's next?
Yeah.
Is plastic surgery next? Is wearing your hairstyle next? So I think it's a slippery slope, and it really kind of bummed me out. And I even had doctors telling me that there's no data that shows that gender transition surgery helps. And I was like, I know that's not right. I mean, I don't know the studies, I can't quote them, but I know that's incorrect. And so I want to do a segment on what are the long-term effects of gender transition surgeries for adults. Well, once again, as I said, and you can look at the other episode, I think it's wrong in kids. There's a whole bevy of reasons that I think that that's not right. So transgender Americans do make about 1% of the population. So it's, a significant amount. What is that? 3.5 million people in the United States.
What are the things that are considered to be transgendered? Like, what do you have to be?
Well, I think that
characteristics you have to have.
Oh,
to
right.
be
Okay. So
transgendered?
it's somebody who suffers from gender dysphoria, meaning that they feel as though their phenotypic body, so a male body is not the right body for them, or vice versa. And so kind of going through that process of recognizing gender dysphoria, it's very important that people seek out a mental health professional. And I don't mean that in a bad way, like, okay, you have a...
Well, it's a confused, to me, I'm confused by it, so I can only imagine a person
Right.
that's
You can only imagine people that's
that,
undergoing it would be confused
what's
about all
wrong
that.
with me?
And I'm going to talk about some of the effects that has on people. There's a lot of research into people who have gender dysphoria and the things that they suffer from versus the average adult.
Just being... growing up thinking you're different than a group of people.
Right, it's hard enough to grow up, when you don't have issues that big.
If you just think you're just a little bit different than somebody,
it's tough.
it messes with your head. So you can only imagine.
So I just want to talk a bit about, for those who don't know, the process. And the process of gender transition is very individualized, and it doesn't always go by these steps, but these are kind of some of the steps that people will go through who have gender dysphoria, who decide that they want to transition. The first is self-identification, self-reflection and knowing what identification that you really are. Next is coming out and letting people know that, telling friends, telling family. Following that would be like a social transition, things like you might change your name, change your pronouns, change your clothing, change your appearance. As I said, psychotherapy, psychological or psychiatric evaluation, that is important. It's not a negative. It's not something that should be looked down upon. It's very important in the process to have that mental health support. The next steps would be the bigger steps, things like hormone replacement therapy, so taking hormones to initiate sex characteristics of the gender that you want to be. Legal transition, so legally changing your name, changing legal documents, and then you would get on to surgical transition, which would be either top or bottom surgery or both for people. And then lastly would be the continued mental health support. And so one of the things that I found striking was how many people thought that there's no data to show that this is helpful. And so I know I'd seen the data out there. I knew there was a lot of data. I mean, gender transition surgeries have been coming around for decades.
Yeah.
The first one was in the 50s or 60s. This is not a new technology, although the technology has gotten better and better as the years have gone on. So I did a pretty good literature search on this, specific to transgender patients who'd undergone surgery and what were those effects. And so I got some data, and at the end I'm going to post this data. Oh, here it is right here. So I pulled more studies than this. These are the studies that I'm quoting, and I'm not going to name them all because they're very long titles, but that's 4 of them, and then I pulled 4 more. So if you want to go back and look at these studies, you can. I think there's another set of them. Travis, you got the next one up there? Yeah, there we go. So these are the studies that I'm going to be quoting here for the data that we have. And the first thing I do want to say is that most patients who do gender transition surgery do wait at least 1 or 2 years. I saw a thing out there today on social media about I think it was the Matt Walsh blog, called some clinic that was doing overnight transition surgery, which I would be very much against. I mean, that's just a terrible, terrible idea. But most people who go through the process in the right way do wait at least 1 or 2 years. And also the desist rates. Remember we talked about desist, which is where people change their mind about their gender identity. For kids, it was really high. That's why I'm against that in kids. In adults who go through gender transition surgeries, it's extremely low. It's a fraction of 1%, which I think is important. Because you want to make sure that people aren't doing these surgeries and then regretting that, because there are very difficult.
Some irreversible
situations. I mean, it's practically irreversible. So the studies I want to quote, first was the American Journal of Psychiatry from 2019. And this one talked about, in addition to the positives of transition surgery, the negatives that people with gender dysphoria have over the general population. So people with gender dysphoria have a 6 times risk of having mood, or anxiety disorders. 3 times risk of being on medications for those, and this is the shocking one, a 6 times risk higher chance of having a suicidal episode, like trying to commit suicide. I mean, that's terrible. 6 times, that's so high.
Like going through or?
Attempting.
Yeah.
Attempting. Attempts, yeah.
No, I'm saying like people with those characteristics are going through transgender stuff, or
people with gender dysphoria.
Okay.
So this is people who feel like they're in the wrong body. It's not people who are going through
I thought you were talking about
no,
going
that would,
through the
no, that would be
the
bad.
process.
No, this is on the front end for people who have
Okay.
gender dysphoria who feel like they're in the wrong body. Those people are at much higher risk for suicide attempts and mental health issues.
Yeah,
Right.
well, that makes sense.
So the study went on to talk about how does transition, and I'm talking specifically about surgical transition, because you could talk about how does social transition affect it, how does medical transition. I was speaking specifically to surgery because that's what I was talking about whenever this whole thing came about. So this study showed a statistically significant decrease in the need for mental health treatments after people went through transition. A study from JAMA, which is Journal of American Medical Association, Surgery, 2021, it had 2 groups, people who had gender transition surgery and people who wanted gender transition surgery but hadn't done it. And this one was pretty telling. It showed that there was a 42% decrease in psychiatric distress or psychiatric issues for people who had gone through the surgery, and a 44% decrease in suicidal ideation. So suicidal ideation means that I don't necessarily attempt to commit suicide, but I'm thinking about it, which is a precursor to people actually attempting or committing. There was a journal from Germany called the Medical Sheet, 2019. This one was a literature review. It actually looked at 13 articles talking about people who had gone through transgender surgery. And it showed that there was an increase in the well-being, sexuality, and the overall quality of life of people that went through transition. It did show that there's actually a decrease in the overall pain-free feeling of patients. I guess that's because they just went through big surgeries. That kind of makes sense. And an overall decrease in energy. And I just want to throw that out there because I think that you want to look at both sides of everything.
Yeah.
There was an article in 2022 from the Journal of Sexual Medicine. 37 patients before and after gender transition surgery showed increased quality of life, increase in self-esteem, and decrease in episodes of depression. So, and I'm going to just go ahead and list all of these because I think that the data is pretty clear. International Journal Transgender 2022, 246 patients after transition surgery showed increase in quality of life, increase in self-esteem, decrease in depression, almost identical to the past.
Yeah.
Dutch study 2006, suicide rate of patients was 5 times less after gender transition surgery than before. Pretty significant. German study 2018, 156 patients with gender-affirming surgery had overall high satisfaction rate with their surgery, overall increased quality of life. Lastly, Annals of Plastic Surgery, journal I know very well, 2022, 100 patients that went through the surgery, overall increase in well-being, high satisfaction rate in surgery, decrease in mental health issues, decrease in suicidal ideation. So, and that's not to say that, going through gender transition surgery is without risk.
Yeah.
I mean, the surgeries are big surgeries. The ones I've done, I only do top surgeries. I haven't done tons of them either because most people that go through gender transition surgery go to people who only do that.
Yes.
I've caught a few over the years because they're not super complicated surgeries and I can do them pretty easily. What
sex usually goes through the trans?
It's mostly
surgeries?
male to female is the biggest
That's
one.
what I thought.
I don't know the percentages. You always see the male to male is a little bit more common. I've done both ways, and like I said, not a ton, but yeah, I've done both ways. And the surgeries for the tops are pretty. The bottom surgeries, the big surgeries, that's real big. You're talking about trying to create something totally new than what you got. But anyway, it just honestly made me sad that people going through something so life-changing would have other people say that you shouldn't do that or you can't do that. I mean, I really feel like people, as long as they're not harming someone else, should be able to do to their bodies what they want. I mean, and I think most people deep down think that too, although I don't know, I was kind of questioning that. But I just wanted to kind of show that the data does show that for the people who are going through gender dysphoria, and this is for adults, not kids, that if they go through the transition, overall they're happier. And overall their life, their well-being is better, the risk of them having significant psychiatric issues goes down. So I think the data is pretty clear.
Yeah.
So big topics. our topics are getting bigger. Like, we're talking about bigger stuff. I don't know if that's good or bad. I mean,
More serious, yes.
but
yes.
we're serious here. So, all right. Speaking of big topics, this news article just popped up this week. Did you guys hear about this plastic surgeon on trial for negligent homicide for a teen girl?
No, I've not heard this one.
I
thought
heard
we were
about-
going to talk about like another, like the guy. Remember that guy that like killed somebody in the office?
I haven't heard about that, sir. Well, I need to look that guy up. I don't know.
You haven't heard any more about him?
I've been looking. I haven't heard. I'll go back and double check. I need to follow up on a bunch of
I
these.
want to find out
What
going
happened?
on.
Was he going to trial? I can't remember my own segment. He was going to trial soon, right?
I think so.
Yeah.
Yeah, he's the one who like killed his lawyer. Right?
He killed the lawyer that was representing someone that he was suing, which is so random.
Yeah, he like killed him in the bathroom or something.
Yeah.
Right? Yeah.
I'll do a follow-up on that. I think he was going to trial. Well, anyway, this one is equally sad, equally tragic. It came from Greenwood, Colorado. It actually happened in 2019.
Not in Florida.
Colorado.
Yeah.
Not
Good.
Florida. Not Florida today. I know. I thought you'd be shocked. So Greenwood, Colorado. Greenwood Village, Colorado. So this happened in 2019. The reason that it came up in the news this past week is because there's a trial happening. So it's a very sad story. 18-year-old Emmeline Wynn, whose picture we showed up. I think, did you show the picture, Travis? This young girl?
Uh-huh.
Yeah. Oh, you already showed it. Yeah, that's her right there. It's a family photo. Went to a Dr. Jeffrey Kim, plastic surgeon. This guy's totally legit. I looked him up. Plastic surgeon, board certified, has great reviews. So nothing to worry about there. And she was undergoing a breast augmentation in his OR in his office. Okay, he's got one of those office ORs. So this is all alleged. This is coming from the news reports from the trial. So obviously, I don't know for fact. I'm simply stating what was reported by both the prosecutors and the defense in this trial. So the girl was being put under anesthesia by a nurse anesthetist and went into cardiac arrest.
Yeah.
And there was some mention that perhaps she got too many drugs, that she got like an overdose. So the doctor started CPR, regained a heartbeat. That's good. Okay, that's good. This is a terrible situation, but we've kind of righted the ship. But allegedly, he then refused to call 911.
Oh, yeah. Maybe I have heard that.
No, we talked about this on a
Yes.
different patient, but it was a totally different patient, a different doctor.
Oh, okay.
Yeah, this is a new one.
This is a different one.
Different.
Doing the same thing.
Very similar. So what happened is this patient goes into cardiac arrest, and allegedly the doctor refused to call 911 and refused to allow anyone in the office to call 911. So 5 hours go by, and I'm not really sure like what was happening in that 5 hours. Like what were they? I mean, if someone has a cardiac arrest and you manage to get them back, like they are critically ill. Like they need like immediate medical attention. And I don't know what they were doing in the office OR. It didn't really go into any detail. 5 hours later, they finally called 911. EMS shows up, and allegedly he told them the wrong thing, said that she had just gone into cardiac arrest, which does change some of the protocols for how they would treat her. So that's one reason that they're potentially finding fault in this. So they take the girl to the hospital. She goes into a coma, and she dies 14 months later. Never regains consciousness. So obviously a really bad kind of outcome. So when all the details come out, alleged details of refusing to call 911, they arrested the doctor, and he's being charged with manslaughter and negligent homicide. They initially charged the nurse anesthetist with negligent homicide, but then they dropped those charges, and now the nurse anesthetist is actually a witness for the prosecution.
She's like, probably doesn't have anything to do with it. She's probably, I would hope she was like, we need to call 911. Maybe she was the reason 911 was eventually called.
Who knows? I mean, it doesn't say. I'm dying to know like what went down because, and I'll talk about this in a minute. So, of course, now you got the surgeon and the nurse are blaming each other. The surgeon's saying, look, this patient died because too many drugs were given. And then the nurse anesthetist is saying, no, this patient died because we didn't seek medical care. And so this is all apparently going to play out in trial. And it's tragic because, an 18-year-old girl, died over this. And really in a way that shouldn't happen. We've talked about in the past the risks of death from elective cosmetic surgery. It's about 1 in 250 to 500,000. So very, very low. It's about on par with the risk of dying from anesthesia. It's about 1 in 250,000. And I looked at the data, and it's kind of all over the map, and I ended up calling one of my friends to see what he said. And he said about 1 in 250, maybe 300,000 risk, especially in somebody so young, 18-year-old, but totally healthy. So it's a very sad situation, and just like everything, when we have these terrible events we talk about, I always want to know, is there anything we can learn from this? Like, is there anything that was done that is a problem or that we can learn from and potentially prevent it from happening? And of course, I would go back to, if it is true that they refuse to call 911, I have an enormous problem with that.
Yeah.
I can't imagine the thinking that you wouldn't call 911. I mean, I guess the thinking, trying to put myself in why would they do this, is, if I call 911, then obviously it's a big deal. Well, I mean, it is a big deal. Somebody went into cardiac arrest.
Well, having surgery is a big deal.
Yeah, I mean, you have to do that. And so, and then I think, okay, well, is there anything to learn for patients from this? And
yeah, don't have surgery in office OR.
man, you steal my thunder. You're getting too good at this. Like, pretty soon.
Well, every time you tell me a story, I'm like, I already know what's
you're
wrong.
like making mental notes of like, what you should and shouldn't do.
Yeah, I already
so,
know.
and that would be the thing that I would probably mention is, so for example, when I'm in surgery in my surgery center, if I do something that seems unsafe, I can promise you and assure you that the people will tell me that it's wrong, and if I continue to do it, they will escalate that up the chain.
Yeah, well, if somebody's coding too, they're like, you're in a hospital.
Well, I mean, this is a surgery center, so it's better in a surgery center than an
Yeah.
office, but yes, but my point being is that in that scenario, if it's true, it's once again, it's all alleged, come out in trial. If a doctor refuses to call 911, obviously someone should step up and say, this is wrong. But if those employees are personally employed by that surgeon, then there's more pressure that surgeon could put on them. Because if something happened in the OR and I said, no, we don't need to do anything, and I say, I forbid you from going to find someone to help, like the people in the OR would be like, sorry, I will lose my job if I don't do that.
Yeah.
They're not going to cover for you.
Yeah.
That is different when someone is in their own private office OR, and we've seen that if it did happen allegedly here, and then in the case we talked about a couple weeks ago. So does that mean that it's not safe to get surgery in office OR? I mean, no, I wouldn't say necessarily that that's
It's not like the best option.
the point here. I would say that you're right, that there are some potential things that can happen in an office OR setting that could be bad that may not happen in a hospital or a accredited surgery center.
Yeah, and I guess like a thing to say for nurses and people that work for
Speak
doctors
up.
that have that, like,
Yeah.
even if they tell you not to call 911, you're not going to be working for them much longer.
Right,
They're going to fire
exactly
you,
right.
or
Either fire you or
or they're going to be everything's going to be taken away from them. So it's
Yeah.
like you better just go the right course.
Right.
And not.
You wonder if people could be held liable for refusing to call 911. Well, the problem is, and probably with this scenario is that probably there was no one in the OR outside of the nurse anesthetist that you would say is high enough to make that decision to override a doctor. That's probably where they're getting off the hook. But I mean, it does bring up the legality of, does the average person know that we should call 911? If they don't do it, should they be held accountable? Because we've now seen two in the past, month or two, where this exact scenario played out, where 911 was not called and then the outcome was bad. Mm-hmm. So it's sad. I mean, and this guy seems like totally legit. I mean, that surgeon's accredited, board certified, it's a long history. I just don't know. Maybe there's more to it.
Yeah, usually there is.
I'm gonna have to follow up on
I feel
that
like
one.
anytime somebody's like killed, there's always more than meets the eye.
Yeah. I don't know. I assume that it'll come out in the trial, so I'm going to have to follow up on this one and see what went down. That's just crazy.
Yeah.
But it is good to, not at all to sensationalize these things, but to learn from them. What can we learn from this bad outcome and prevent it from happening again? I mean, I think that's our duty. So
we should make a podcast about plastic surgery murders.
isn't that what we have?
And we pretty much have. Yeah.
I mean, I think
Specials.
we could do a special. Yeah, think about it. I'm game.
Have you ever seen that show about murder, like with Selena Gomez on Hulu?
No.
It's called Murders and something.
No.
It's really good, and they have a podcast.
Really?
Yeah, that old guy, what's his name? Two old guys, two old comedians.
Like older than me?
Yes.
Okay.
Both from Saturday Night Live.
Oh, really?
Yeah.
So like Steve Martin and
Yeah.
is he one of them?
Yes.
Really? All right, I'm not looking. You know all the good stuff. I'm gonna look it up.
It's a good show.
I got a couple like things I have to watch this next week.
Yeah.
All right, everybody. Thank you so much for tuning in. We really, really do appreciate it. Please leave us a comment. We'd love to know what you think about these topics or what topics you'd like us to cover in the future. Thank you so much.